All right, welcome to Till Talks with Chris White, where we talk TILs, tumor infiltrating lymphocytes, and all advanced cell and gene therapies, both with patients and caregivers, along with industry leaders. Let's get going. As a reminder, I am not a medical professional or medical expert. I am only a professional and expert on my story and my experience. If you are needing or seeking medical advice or assistance, please reach out to your care team. All right, we're rolling. What's up, Deanna?
Just sitting here talking to you, Chris. Happy to be here. Thanks for having me.
Absolutely. I'm trying to remember. So, did we connect through the TILS group I made through Facebook, or did we connect through the mucosal melanoma group, or
I'm pretty sure
remind
it
me?
was I'm pretty sure it was the mucosal melanoma group. Yeah, pretty sure that's the group that I've been my main go-to since I was diagnosed November of 23.
Okay, that was going to be my next question was one, when were you diagnosed, which you just mentioned, but two, what led up to you going to the doctor and getting checked out and actually figuring out, oh shit, I have cancer?
Yeah. So for, I would say a few months, let's see, along about late spring, early summer of 23, I was due for a colonoscopy. And so I was starting to pursue that. You have to go and get the consultation and all that. So it's actually a few months before you actually get the procedure and the test. But during that time, I had what I thought was probably a hemorrhoid. I didn't have a history of having any hemorrhoids. But I had this weird little growth thing. And so I just thought, well, rather than go and separately get that checked out, I'll just mention it during this whole thing with the colonoscopy and get it checked out. So I mentioned it at my initial consultation in the summer. And I said, yeah, I think I have this hemorrhoid, but it's bothersome. It's not going away. And they never examined me. They just said, well, they prescribed more cream and all the stuff. And so I get to the colonoscopy October. That the consultation was in August. The colonoscopy was October. And in the report, they diagnosed it as a hemorrhoid, but that they couldn't do anything about during the
Really?
colonoscopy.
Shit.
And yeah, so I was misdiagnosed. And so the doctor actually told me to keep doing these creams and all this for another few weeks and then to come back. And he had planned to do a banding procedure to get rid of the hemorrhoid. So I come back a month later in November and he said, well, it's no different. I said, I know this is how it's been for months. And he said, well, I can't do anything with this. I'm going to send you to a surgeon. So he sent me to a surgeon and the surgeon knew right away what it was. He didn't say, he said, I am worried this is cancer. And the very next day he got me into surgery and he resected it and confirmed that it was mucosal melanoma. So yeah, it was a really,
Yeah, like
yeah.
that moved that quick.
Yeah, quick once, the surgeon got involved. Yeah, I've been pretty disappointed, and definitely wondered if I should get an attorney involved in that. But, I've been pretty busy trying to stay alive.
I know the feeling, and it's way too familiar. Like I
Yeah, yeah,
I beat myself up sometimes and, know what to forgive myself for it, but I literally waited about 5 plus months before I even, like, asked to get it checked out, just assuming it was a hemorrhoid, and I had never had a
yeah,
hemorrhoid before, but I had heard about
yeah,
them. It's like if you have a growth that's on the rim of your ass,
yeah,
what
that's
else
pretty
would you
much
think it is? I mean, like,
exactly
it's not like a popular thing to be like, "Oh, well, that's probably cancer," you know what I'm saying? It's not like
right.
I've seen pictures of hemorrhoids before, I've heard of them. So, your surgeon, as soon as you got referred to him, said and scoped it out, had, like, at least seen this before or,
He knew. Yeah, he didn't use the terminology, but he said, I think this is a tumor. So, yeah, so he was right. But from there, I got referred to, I went to a couple different oncologists to see who I liked. And I ended up with one who was phenomenal. And I still am sad that I didn't continue with him, but he wasn't a specialist in mucosal melanoma. So I had to find a specialist. As we all know, that's the best thing. But that initial oncologist, he called all the experts, he bugged everybody to find out what to do for me. And he did protocol. He started me on Ipi-Nivo right away. He knew that the neoadjuvant approach was the way to go to do that. And then down the road, do more surgery. In my case, I was always inoperable, at least from the people I've seen. No one has been comfortable doing additional surgery with me. So from Ipi-Nivo, which didn't work after a few months, in fact, I progressed pretty extensively. It was horrific. And confirmed to not be pseudo progression. I suffered a lot of progression, and there's a risk of full blockage for me in the early part of 24. And so I ended up with, after trying to find a surgeon and trying to figure things out, I ended up getting referred for radiation. Radiation saved me, shrunk my tumors quite a bit. At the time, I just had one internal tumor. Now I have a couple, but it saved me, but also radiation was horrible. I had really bad side effects. I had proctitis, and it was really unpleasant. And to be honest, still is. I think anyone who does radiation needs to know that they're in some way not going to be the same again. Like, it's just the nature of radiation. You can heal, but it's pretty intense.
Like, for anybody like that has never done it, let me just like point this out. Imagine if you have ever been sunburned anywhere, but then imagine that on a specific location of your body and then times that by 100. Okay.
Yep.
It is the most uncomfortable effing feeling I could ever think of. And you don't know it until you experience it. But
Yeah, and it's a sensitive area and it just kind of goes crazy. And so, like, it's terrible side effects. I mean, the most disgusting thing you can imagine. I could not control anything about my function. So, and I was still working at the time. I was like on Zoom calls from bed in the bathroom, off camera. It was terrible trying to function, but it did save me. Since then, the theme for me, and I think for a lot of people, has been making decisions around what's next and trying to work with your providers on what the best choices are. And I ended up with an oncologist who is supposedly an expert in mucosal melanoma. I know a couple other folks who go to him in our mucosal melanoma group. And I ended up trying Opdualag for a few rounds after Ipi-Nivo didn't work, and I had the radiation, and I had another chance to get things right. But the Opdualag, it was hard to ascertain whether it was working. I didn't progress. I stayed stable. I was having Signatera tests monthly, but really it was hard to communicate with my oncologist about what are we really looking for here. I remember getting a looking pretty good. Signatera was staying low and I wasn't having any progression. And then I had a Signatera test kind of with an uptick. And I remember just the idea was, oh yeah, this might not be working. And so I was pretty freaked out. And I remember I had heard about TILs a lot by that point. I had, read a lot. I
and this is early
read,
2024, right?
this is about mid
So
2024.
it had been
This is,
approved.
yeah,
Okay.
it had already been approved. So, yeah, all that I heard was you want to do it sooner rather than later. You don't want to wait. You want to do it while you're a good candidate and you're strong and all of that. So I went on from like a little uptick in my Signatera to basically pursuing TILs, which I do not regret, but I don't feel like it was ever clear, and it still isn't, why my oncologist supported me moving on to TILs from basically a place of stability. I know why I did. I did it because it's proven to be a durable treatment so far. And I like the fact that people like you have been disease free for a number of years. So that was very attractive to me. It's like, well, I know I can survive this treatment. It may be unpleasant, but it's temporary. And if it works, it's durable. So for me, that was a good option. And it was just looked like Opdualag either wasn't working or it was unclear. But I'm mentioning this because I think it's important that people understand they can choose a different treatment at any time. But also, I think we need to hold our oncologists accountable to decisions and recommendations. I had learned since that a Signatera result like that is not a big concern. And it looked like months later that Opdualag may have been working for me because it took a few months for me to get all the TILs stuff in order. There were a lot of delays. But looking back, I don't think my oncologist really did their due diligence in terms of helping me understand what was going on and what I should be looking for from these tests and from these treatments. So that's something I really want to emphasize in terms of decision making for us as patients.
Such a good point right there of what we're talking about. And I was just thinking, I was like, man, I got a couple of mental notes that I want to highlight and have you reiterate. But and you don't have to name any of this, but were a couple of questions. Were you at a academic center or a private oncology setting when you were
Private setting.
okay, a private setting? And I also want to highlight, which I always encourage people to do, but you had multiple opinions when you got started and were trying to figure out treatment options. You just didn't settle for the first thing. In fact, they encouraged you to or and also helped you find everything that could possibly help you that was out there. I mean, not that's not the same story with everybody.
Yeah, I don't know that they did help me. I think my initial oncologist did. And that's what's so strange is the big messaging is you have to have an oncologist who's a specialist in mucosal melanoma. And I listened to that. I feel like my initial oncologist was far better than the one that I found who was a specialist. He had my best interests at heart. My second one, I think, tried to, but I don't know if he just wasn't the best communicator. But
That
I later
happens.
asked him, what's that?
I said that happens. I mean, sometimes when they're
Yeah.
so immersed within the science and the work and everything,
Well,
the
I
humanity, like, and the just the personal people skills, it's like
Yeah,
they're
I
just not
asked
always
him
there.
later. I asked him later because I now know that there should be a bridge therapy before you have TILs. Like, it's a good idea.
I mean,
I
especially if you
asked
need
him.
it or
Well, I
you're
asked him, I
progressing.
said, why didn't you just keep me on Opdualag? And he said, I don't remember why. And it's like, well,
That kind of response, I mean, it's like, you don't remember, like,
it's not in his notes. It's terrible. So it was that. And then months later, when I'm about to start TILs, he says, I don't recommend that you continue with this now because I think Opdualag was working for you. And I said, well, why shouldn't I continue with it? I don't understand. He goes, well, I just don't think you should if Opdualag was working. But I don't think that's an answer to the question. To me, the answer is, well, sorry,
it's
my
okay.
dog.
I
Um,
love dogs.
it's okay, Max. Max, it's okay, Max.
Max got your back.
Somebody walked by.
Hell yeah, Max got your back.
Yeah, he does. So I said, like, I need more of an answer, right? Like, what is it about TILs that, and I didn't really get an answer. Like, why are you not recommending it? And so I'm only left to guess that it's just, I think in some people's minds, TILs is still not something to do right away. And, to me, it was like, well, if it doesn't work, fine, I can move on to something else. And if it does, then great, I've got a durable treatment. But yeah, I think doctors, my experience highlights that doctors need to be accountable to how they're helping their patients make decisions and answering the questions about why they're making a certain recommendation. So, yeah, so the decision making around and help with patients, I think, is so important. And
Did you
yeah,
do you have, like I've heard a couple of people talk about this recently, but there has been positions created at certain oncology settings to where they have a patient navigator that literally helps you coordinate no matter what you're doing or who it's with, even if it's outside of their organization, to make sure that it's a seamless and flawless experience for you as the patient.
I've heard of this, and I don't think I've ever had that. I've heard of
I
it,
didn't have it.
and I feel like I was introduced to some people who may have done that, but I never had anyone take me aside or communicate with me and say, "Okay, let's talk about this or let's figure it out." No one. And so I don't know what makes the difference or if I was supposed to ask for that. I have no idea, but
Because
you know,
let's throw it in like a hypothetical scenario. Like, say you live at point A, middle of the country, wherever, right? And they provide tills, but they have a backlog in order to get in because they can only support X amount of patients at X amount of time because they only have so many beds. And then at the same time, you also have to remember that they can only manufacture and produce your bat at a certain rate. They have a minimal time frame. Like me as a clinical trial patient, like it was ready within like 3 weeks. But depending on where you're at and how many beds they have and what the backlog is, sometimes patients are saying like, man, it's like minimum 6 weeks. And so, I mean, that can
yeah.
vary or differ, but it's like if you're willing to travel and you have insurance and or the funds that you can go out of state or to another location that might have an opening sooner. Are you willing and wanting to do it? And is it available? And there's obviously the FDA approved version of TILs, but there's a handful of other clinical trials out there that are actively recruiting to where you can do TILs. It's a little bit different of a process and it's from a different sponsor, but there's not always necessarily somebody there going, okay, here's where you're at. Here's everything that's available, and this is where that's at. And then this is what it
No.
would take to get there and how much it would cost and your inclusion, exclusion criteria, and all of that. It's a lot of stuff to take in. And there's not necessarily somebody that's dedicated to helping the patients out and explaining, like, okay, here's
No.
everything that's available. Here's where it's at. Here's what you qualify for. Here's what do you want to
And
do?
I don't know that we can expect to have that, but I know I did all of that. I did as much research as I could. I even so I had decided to pursue tills and I had a whole other issue with my insurance not wanting to approve tills with one facility and instead wanted me to go to a different facility that basically had different cost codes. It would be cheaper for them. And it delayed things by months. So that's
Yeah.
the other thing that not just us as mucosal melanoma patients, but all cancer patients, all people with life threatening illnesses deal with in the US in terms of we are delayed by months here to get the care we need, and it's very scary. And I had that happen during this whole delay. Like I said, I had maybe some response to the treatment I was getting, and my oncologist kind of changed his tune about TILs and whether I should pursue it. And I ended up doing exactly that, like going and getting other opinions. I went to Memorial Sloan Kettering, I went to Hopkins, and I even went to Dana-Farber in Boston. They were doing a trial that I was interested
They're
in.
still doing trials
So
there.
Yeah, so I did a lot of work and a lot of research. Nobody wanted to, on their notes, throw my oncologist under the bus, but they were quite confused about why he wouldn't want me to pursue TILs. And so after all was said and done, I went ahead with it. And I can tell you about my experience with TILs, or I can tell you where I am now and go backwards.
I'd love to hear all of it. That's
Okay.
exactly yeah. Take your
Yeah.
time,
So
start where you want. Yeah, I wanna hear it
so
all.
I ended up going ahead with TILs against the opinion of my oncologist. And the doctors with that, they were perplexed too. So I felt like I could trust them. They don't have a shortage of people doing these things. So it's not like they were desperate to have another patient. So I trusted them. And so I ended up getting my cells harvested from my right inguinal lymph node in December of 24. And that's a pretty easy minor surgery. But my lymph node at that point was about the size of a
I was
walnut.
gonna ask you how big, and then was it, like, sticking out of the skin, or was it underneath?
No, it
Like
was
okay.
underneath. You could just feel it. And so, had that surgery done, they felt like it went well. They felt like it was a good harvest. And then I was admitted um, to let's see, University of Maryland Medical Centers, where I ended up getting my TILS procedure and treatment. I was admitted in March of this year and I did really well. The chemo was a breeze. I mean, the days of chemo, people getting sick and that whole thing, I'm pretty sure are over. Like it was, they just give you medication to prevent that. And so it was not a big deal. I did pre-shave my head because it was certain that I would lose my hair and I had long hair and I didn't want the
You
mess
had long
of
blonde hair, like, I've seen your pictures, I mean, it was probably
yeah.
halfway down your back, right?
No, not that long,
Well,
but
but I
long
mean,
blonde hair.
past your shoulders
Yeah.
long, right?
Yeah.
Okay.
Yeah, yeah, and I just didn't want the mess of pieces of my hair coming out, and so I went in with it shaved. I thought that was a great decision to pre-shave,
Yeah.
and, so when I did look at your recommendations, you have that good list of recommendations, and I bought the things and all the things. Some I didn't need, which is interesting. I'll mention this. Patients are different, and
Yep.
I'll mention that,
Did hold on.
how my
Did you
yeah.
did you donate your hair when you shaved it? You didn't? Okay.
No, it didn't seem like it was really long enough
Okay.
or robust enough,
No,
so
I
I
gotcha.
didn't.
Just curious.
But yeah, so I did that and but anyway, that first part was real easy. The nurses were great. And then the second part where you're moved into the intensive care unit and you're given the cell infusion, the care was good. And then they started with the IL-2 infusions after the cell infusion. And, for me, it was super similar to radiation in that I just had absolutely no control of my function. And so the medical term is fecal incontinence, and it was just awful, but I had really good care and nurses that we figured out how to deal with that. And the other things that I had happen were hallucinations. I had never had hallucinations before. I've never done any hallucinogenic drugs, but clearly hallucinations. But I was aware that that's what was
Okay. I
happening.
was gonna ask because not everybody
Yeah.
always knows that that's what's going
No,
on. Okay.
I was aware. Yeah, I was like, this is a hallucination. This is not real, but wow, this is amazing.
That's what I was gonna ask. Was it like a feel good experience or a non feel goods? Because people will talk about, hey, I had a good trip, I had a bad trip, and
It was neither. It was just it is.
okay,
So it was
okay,
not bad or good. It was more bizarre. It was like
okay,
it was a bunch of people coming in and putting things all over the walls, like really gaudy decorations and stuff. And the hospital's sterile, right?
yeah,
And it was like it was this gaudy sort of castle type
okay.
thing. And it was weird. It wasn't bad or good. It was just weird. So that was that. And I was also very, very weak because, that's what they do to you. They
They have to bring your
dumb
immune
down.
system to a blank slate.
Yep. Yep.
Yep.
And you're just totally weak. And at one point, I stood up and I passed out. I stood up to go to the bathroom and I passed out. Well, they freaked
Did
out.
they call
And
code
then
on you?
they had the whole thing. And then they had the protocol to prevent me from falling when really it's like the protocol is like I tripped, but I didn't trip. It doesn't matter where I was or what I was doing. If you pass out, you're going to fall
Yeah.
and you're not going to
It
prevent
doesn't
that.
matter what kind of health position you're in.
Yeah. And here they're lowering the bed, they're putting mats down, they're doing all this stuff. So,
Shit.
that was weird. And then I did not get the fevers and chills and rigors
Okay.
at all. I got slight fever, but not like insane. So that was interesting. I slept a lot, to be honest.
That's incredible because it's hard to sleep in a hospital. I mean, like people coming in all the
Yeah, but
time and checking your vitals and all that shit.
I was still on my pain medication. I was on oxycodone. So I slept a lot. And I remember the nurses coming in and doing another infusion and saying, "You're doing great." And I really was. They only missed one to give my body a break because of all the crazy fecal incontinence. But I ended up with 5 total doses. Everybody's happy with that because there's no evidence that the 6th dose even makes a
Yeah, they
difference.
prefer or they
So
recommend 6, but there's also have evidence that says 1 to 6 anywhere. Like 1's better than nothing, but
that's right.
something's better. Anything will
Yep,
work. Yeah.
right. So we were all pretty happy with that. And then I moved out into normal hospital room, and at that point had been there a long time. Number 1, I was starting to have more delirium at that point, and I needed sunlight, I needed to eat better, and so that last leg was hard for all of those reasons. But I did really well. I was a strong candidate, and I'm a strong person, and so that was good. And I came home with all my caregiver support in line, and I ended up only needing 24, I think it was 2 or 3 weeks, maybe even 2. My doctor said, "Yeah, call it off. You don't need overnight caregiving anymore." So that was good. I just recovered really well. And, we've done scans and Signatera tests, and I kind of have still stayed sort of stable-ish. The tumors have changed shape. I have an internal tumor, and over the past year, I developed an external tumor as well. But they've never been fast progressing. But the idea, what we think now is that I'm having some sort of a response, but it's definitely not fast. That is really problematic for me because my tumors are causing a lot of physical problems and my quality of life is really poor. I take pain meds every day. I have to. And I use over the counter stuff to try to control my function. It doesn't work very well. They say, "Oh, try this diet, that diet." You never know what's going to happen one day into the next. And so I'm pretty uncomfortable. I don't go anywhere unless I know I'm going to have a bathroom available, and it's tough. And so even though it seems I'm having a response, it's definitely not fast. And so I'm facing yet another pretty big decision, and I'm going to get other opinions. But even though it's not going to cure the disease, it's now a recommendation from my TILS oncologist to pursue APR surgery. And I have thought about this a lot for the last several months because what that would do. Now, there are people, we know this, who would rather be dead than have that surgery. I personally don't understand that. I'm type 1 diabetic. I already have a couple pieces of tech on my body that keep me alive. I've researched it a lot. I've seen people living with a stoma, and really what everybody says is, "Yeah, I thought it'd be bad, but it's really not that bad." Pretty much everybody says that. But nonetheless, it's still personal and individual. And so I'm doing a lot of thinking about that, but I gotta say, it would take away everything that is causing me to have a poor quality of life. I wouldn't have to have the pain meds. I wouldn't worry about a bathroom anymore. I mean, I could go into all the details of all the things that I have every day to manage. And I think it's worse than a stoma, but I think some people think it's better to just be in your house all the time dealing with this rather than have a stoma. I don't know. It's weird, but that's what I'm facing. Even though TILs might be working some, it's not working enough and fast enough for me.
And that's the thing is because Tills is specific for you, like you can't, it's nothing off the shelf. They can't, somebody else, I mean, it's literally your cells. And so you can't get it from anywhere else. And it's your quality of life and it's your decisions. And I mean, shit, there's just so much that goes into it. And I'm just sitting here thinking of, I got a handful of questions from what you have just brought up. And I guess I'll just try to rewind from one of the first things. So, when you were admitted into the hospital, you did your lymphodepletion. Is it a requirement since you did the commercially available FDA approved version of TILs? Is it required that you have to go to ICU when you're getting ready for
Yes.
IL-2? Is that just at that location or is that everywhere?
I know I was pursuing it at a different location and it would have been the same thing. So
Really?
I'm pretty sure that's protocol.
Okay.
Yeah. Yeah, because things can go wrong, and so they wanna be prepared.
That's yeah. I'm still getting consensus on it because I was a clinical trial patient for it, and they would always tell you like, if needed, we will
Yeah.
expedite you to ICU, but that's only if we decide that we got to take you there. And I've talked to a lot of other clinical trial patients from my same cohort or another cohort that
Yep.
did or did not have to do it, but it wasn't like mandatory protocol. I'm not sure if I've connected with other patients that have also said, "Hey, exactly what you were just saying," which is like, "Hey, that's just how it is. You go there just in
Yeah.
case and everything." And
I'm pretty sure, and I have to say I can understand that
yeah,
because transporting a patient that's in distress could be
any
not a good
yeah,
idea.
I mean, we're in a world where like Murphy's Law, anything that could happen can happen. And shit, if
Yeah.
it does, like you
Right.
need to be in the best place where they can help mitigate that. You know what I'm saying? And
Right.
so like,
And the other thing with me is that's worth mentioning, and I just said it, I am type 1 diabetic. I don't know of any other type 1 diabetic who has gone through TILs. I may be the only one because they didn't have any notation on it at all. They didn't have any recommendations. And I didn't mention it until now, but what's very interesting is I was under careful watch of endocrinology also because of my type 1 diabetes. My insulin requirements dove like down to half of what they normally are while I was on IL-2, which is amazing. Like, the fact that a drug would do that. So, and the opposite reaction can happen from a steroid, like prednisone. It's been in me and my doctor's minds that if I have side effects that would require prednisone, that's going to be a major problem for me because that causes major insulin resistance.
yeah,
This was like the opposite. And so they were taking pretty copious notes on me for the provider to understand that, yeah, that's going to be a potential side effect for if you're on insulin. So that was fascinating. And after I got out of the hospital, slowly it went back up to my normal needs.
that's wild.
So very
That is
wild.
very
Yeah,
wild because they're working on advanced cell therapies for diabetes.
absolutely. Yeah.
And I'm sure your data would be very helpful in those trials and that science. I mean,
Yeah, there are drugs all the time that are surprises that cause certain things that, "Oh, okay, this could be helpful in another way." So,
yeah,
yeah, so that was wild and unexpected for sure.
And that just reminds me so much of you don't know unless you try, and you're only gonna miss 100% of the shots you don't take.
Right.
But I mean, wow. I'm just like back on track. All right, so you get admitted to the ICU. You get out of the ICU. You do 5 out of the 6 IL-2s. You don't really have a lot of the typical symptoms of the Rigers that are explained. How many total days were you in the hospital for admission?
I was It was about 2.5 weeks. I was
15, like 17 days, I guess. I don't know. Is that
Yeah,
something somewhere around
yeah,
there?
that sounds right. Mhm.
Like,
Yeah.
I've talked to a couple other people about this, and I'm sure you can probably concur, but I've never been like officially incarcerated, but I could only imagine it's like being like, oh shit, I'm out, I'm getting released, the cuffs are off and they're letting me out the gate. I was also like, I was put on a fall risk hazard when I was admitted. I'm saying I got the magnet on my door. They wanted to monitor me on everything. And hospitals aren't always necessarily like set up for design, especially like some of the older BMT units. I mean, like the whole goal is to get you in and get you out. But I remember when my younger sister had her second child, my nephew, she was working as a nurse at the hospital that she, gave birth to my nephew at. And she had like a suite, which is literally like a mini, like kind of like an apartment because it was a large room. It had a full size, queen size like bed. It wasn't like your traditional hospital, like short little bed where you can't really move a lot and your pillows are falling off and all that. But it had like a little sitting area and a fridge and, a separate like area room for the husband and this and that. But when you place like a patient and their caregiver in a unit to go through this type of treatment when you're anticipated at on average about 2 weeks, so be more or a little less or whatever. But the little it's not like a couch, it's a love seat of a sense for your caregiver to necessarily sleep on, even if it does fold out. But there's not room, there's not space, it's not designed for that. And I mean, I just remember the anxiety of like going like, when the hell am I gonna get out of here? I'm saying because
Yes.
I
Yes.
I just it was just this uneasy feeling of uncomfortableness that I was not in control of. I wasn't in control of when I took my pain meds or anything. Like as soon as I thought I was gonna be able to sleep, like I couldn't. People coming in at all different kinds of hours, pulling
Oh, yeah.
pulling labs, checking vitals. Anytime I had to, use the bathroom, I had to pee in the jug so they could check my pH and like
Yeah.
it was a one of those things. I mean, I was a clinical trial patient, so it's not like it had been
Yeah.
around and set up and designed for, and hopefully in the future. And I know that they're working on this to build these kind of settings for your comfort. I've talked to other patients where they set up their room with a bunch of decorations and
Yeah,
things from home and
they told me, You can put some stuff up," but I would have had to know that ahead of time, and I didn't wanna bring more than I really needed, but I think yeah, it was a long time to be in the hospital, and yeah, like I said, I got delirium from it, and for the most part, I had stellar care. Towards the end, I had a nurse who the doctor on duty at the time said, "You need to get this woman on a walk outside. She needs some sunlight." And he never did it. And I don't think they have the staff to do that,
but they
but
recommended it.
they did. And it was a long time to be in the hospital. But I want to say, we're talking about this, how it's bad. It is not a reason to not do it. I feel like there's still this overall feeling like TILS is this crazy thing that people do and it's high risk, but it's kind of only if you really need it, but yet you shouldn't wait. It's a lot of mixed messaging. And of course, all I can say is what my experience was, but yes, it's a long time. Yes, it's hard on your body. Yes, there's gonna be surprises, and there's no reason to not do it. Like you're in the ICU.
Yeah.
They
If
will
you
help
need help,
you.
they're there.
Right. So I just feel like I agree with what appears to be the messaging, the growing messaging, which is this is a viable treatment that people should pursue sooner rather than later. I believe that that's true.
So,
Yeah, and that I'm saying that even as somebody who hasn't gotten a response the way you did,
well,
which was very fast and very complete. I don't have that, and I still don't regret doing it.
it's wild because, I was literally the very last patient in the clinical trial for now what's the FDA approved therapy, and, it wasn't my first choice because I didn't know it was an option. It was either, I'm gonna, go to hospice and die, or I'm gonna, try. So it's like 50 Cent, you're gonna get rich or die trying. It was like, I'm gonna
Yeah, yeah.
either live or die trying. And this was it. And the thing is like the statistics that are out there that are currently represented, that those are based upon my trial, which is got approved on an accelerated approval. And for those that aren't familiar with what an accelerated approval is, it gets approved, but it has a confirmatory trial to back it up. As if you get this sooner than later, you will have a more durable response, and this trial will prove it. And there's only 153 total people that got dosed in my trial. And in my specific cohort, which is what they call the pivotal cohort 4, enrolled from February 2019 to December of 2019. I enrolled in like November, was supposed to be dosed in December, but got pushed to January the last date because of the brain mets. But the ORR, the overall response rate for that, which is like I think 31 or 33%, considering is still very good. And there's a lot of FDA approved first line treatments with that same ORR. But what's shown right now is, because this is as a second line of treatment after you failed on a first line treatment, not everybody gets pointed in that direction to go do it as soon as you are available for it. Not all oncologists even know about it, and two, they're not recommended it. If they do or do not know about it, they wait till it eventually pops up. But in this confirmatory trial, as a first line of defense, that's the requirement, is no prior treatment. It's a 2-arm trial. And the thing is 2 arms is no matter what, you can still get TILs. Last I saw, which I think was last summer at ASCO, which means, based upon, the pattern of how they, release their data, they ought to be due for some new data here this year. I would imagine it would either be at, and I'm just guessing here, SITC, which is their like I think 20th some odd anniversary. It's going to be up in DC, actually up in Maryland, and or SMR or ESMO. It's one of those three. That's been the pattern. That's what it was for the specific mucosal melanoma data for the trial. That was for the entire trial as a whole. This is with both the poster and the abstract. But doing it as a first line treatment is showing better efficacy than is if you do it as a second line or later. And that's due to what we call T cell exhaustion. So it's simple terms. If you beat yourself up, the more you beat yourself up, the probably less likely it's going to work. Okay. And when it's a
Yeah,
one
yeah.
time treatment, if the sooner you can do it, the better. And if it works, great. If not, then you have all the other approved options in your back pocket to do it. But as a patient, that's why I'm so passionate about telling people, I'm like, shit, if somebody would have told me from the very get go, like, hey, you could, as soon as you qualify, if you can try this one treatment one time and it works, that's it. Otherwise, you could
Right.
do the other path, which is multiple treatments over a period of time, and you can have issues and
Over a
quality of
long
life. And
period of time. I don't know why people are so into that. Like, there's one guy who is like, the TILS numbers aren't good enough. Well, but the numbers on other things aren't good either. And you're on these treatments for so long and you don't even know what side effects you're going to get. And in my case, I was getting my liver enzymes were increasing at the towards the end of my Opdualag treatments. So, who knows what would have happened anyway with those, and so, yeah, I have no regrets. It's like, yeah, I had Ipi-Nivo and Opdualag before I had the TILs. Did I have, what is it, T-cell exhaustion, like I said? I don't know if that was long enough to cause that, but I know where I am now is not the best place to be, but it's not the worst either. It's weird because not a lot of people end up facing this decision about a major surgery when they're still pretty stable as far as disease goes. It's pretty risky physically to continue to let this go.
Yeah. The whole watch and wait thing is
Yeah,
just yeah.
surgery would get more and more complex, especially with women. You start to get more involvement physically, and it's not good. And even though it doesn't eradicate the cancer, but it could certainly help by taking out the cancerous material once since I'm stable now, if you remove it, you could end up in a better situation. But anyway, that's what I'm facing. It's definitely put me in that spot again where I have to make decisions with a bunch of different doctors saying what they think and go
Are they
from there.
all in agreement, or are they from
I don't know
separate?
yet. I don't know yet. So far, I only have the recommendation from my TILS oncologist. I'm in the process of getting an appointment with Memorial Sloan Kettering again because I want to hear what they have to say. I did meet with a surgeon there before who at the time thought APR surgery was a good idea for me. He's also a surgeon, I don't know, but that was in March of 24.
Okay,
That
so
was
it's
a
been a
full
while.
year. Yeah, it's been a while, but he thought at that time that APR was a good idea for me. But
Are you
yeah,
scanning every 6 weeks or every 12 weeks? Or how often are you doing those follow-ups?
every 3 months.
Okay.
Yeah, I'm getting scans, and then every month I'm getting a Signatera test also.
Someone had reached out to me on one of my DMs and they were asking me about Signatera. And the thing is when I was going through my treatment and I did my clinical trial, Signatera, I'm not sure if it was a thing or not, but it wasn't like, here, Chris, you're doing the Signatera test. I just did labs, you know what I mean? And then
Yeah.
afterwards, I remember, I think it was 2021 or 2022 or something, but it became an official thing and part of, a lot of the protocols. Like, are they testing specifically based upon your diagnosis, or is it just a full makeup and
Signatera is just basically looking at the DNA in your bloodstream for your specific cancer mutations. So it's tracking how much is in your bloodstream.
okay.
Mine's still pretty low, but it has had little upticks. So yeah, I mean, I need something else. Or just I need to be super patient with TILs and see if it really does eventually work. But the surgery is the big thing right now, deciding whether or not to get that.
Yeah.
So yeah.
Did I know they did this for me as a clinical trial patient, but I specifically had asked, so hey, if I ended up progressing, what would be the next step? And they had told me like we would redose you with the TILs, which is now I guess what would be, the phase 3 trial. Or I mean, there was a time frame where if that happened within that time frame, it would be part of the phase 3, but they would redose me. They saved enough of my tumor sample in my batch to where
Wow, that's
they
fascinating.
could redo
Okay.
that. Did they mention to you as a commercial patient, do they have extra
No.
samples of your resection set aside or anything, or
No,
they
they never no,
nothing
they
like
haven't
that?
mentioned that at all, but they have mentioned so aside from the recommendation for the surgery, they have recommended because now I have another lymph node that's shown up as possible metastasis, so I'm gonna get a biopsy of that, I think next
Is
week.
that also like in the groin area or the leg?
It's the other side, yeah,
Okay.
it's the left inguinal, the right was the one that was resected, and so I need to have that biopsied, and if it's positive, they've recommended a targeted therapy, a tablet that, starts with an L, levonitab or something,
Is it
levonitig.
approved or a trial?
Oh, it's approved.
Okay.
Yeah, so a tablet targeted therapy. There's also the T-VEC injections, the virus injections for the tumors to shrink. So they've talked about that. So that's if that lymph node is positive, do one of those things for that, and then hope that the TILs continues to work in general for the cancer. Three things, if it's positive, the lymph node, treat that separately, have APR surgery, and if there's still cancer cells running around, TILs can take care of it, or I could go back on another immunotherapy agent. There are still options.
Yeah, it's not like you're just left with like, I don't know,
No,
you got a plan B, C, D, you know.
I do,
Yeah,
and really, I am still without my little headscarf. If I had hair, people would never know that I'm sick, and I get tired, and yeah, I have the quality of life issues, but it's all like nobody knows. If they see me out, they don't know that. So
I know.
I'm still pretty strong. I don't look like a sick person.
I know exactly how you feel. I worked literally almost for the year plus from the diagnosis until I actually did till minus the 3 months of the colitis because of all the immunotherapy, and then
Yep.
I had to take off because of the radiation and a couple of things. But that's the thing is like what's going on in the inside is not always appear on the outside.
No, although I haven't been working for some time. I can't talk about the details, but I am not with my former employer anymore. And I have actually did apply for and was approved for Social Security disability income because this diagnosis is on the list that
Yeah.
approves you for it. So those payments will start in August for me. You are allowed to earn $1,500 a month beyond that. And so I am hoping to find some sort of remote type of work. I've worked remotely for a long time, the type of work I do, but I'm in communications and content strategy, writing, editing, that type of work. And I'm hoping to just find a few hours a week that I can do and not make more than 1,500 a month.
Shit, Deanna, I could probably help connect you, to where you could literally give one talk a month virtually and
Yeah,
earn that. I mean,
that'd
like,
be great. I'm in for it. But that's all I need to do because I live in honestly the richest county in the country. It's pretty insane. Well, I live in Loudoun County in Northern Virginia
or yeah,
and
that
it
that part of
it
the
is
country,
insane.
yeah,
It's pretty
it
insane.
adds
So
up.
I would be fine if I were somewhere else, but I'm not. And I kind of want to hang around. My daughter's in college
Yeah,
a couple hours away, and so anyhow, but I I'm doing okay. I still have a positive mindset. I have not had a whole lot of trouble with that. Yeah, I have my minutes and my hours and my days that aren't so great, but in general, I'm still a fairly happy person. So,
I was telling my mom this on my way back from my dentist appointment this morning, and I've said this many times before, and I get reminded of it all the time. But there's that 10% of what happens to you, but that 90% on how you deal with it. I mean,
yep,
and it's attitude. That's literally it's that Charles Swindoll quote.
yep,
Have to post a picture of that or something. But it's literally, I mean, that is it. And that I feel personally like that helped carry me through all the shit. And it's
yeah.
been 5.5 years since I did till. And like, I'll be the first to admit, like, I mean, it's not like everything's all cool and everything's great. I used to call myself a thriver, but I'm like, what? Like, I don't deserve that because I don't feel like I'm effing thriving. You know what I'm saying? Like, I filed bankruptcy. I'm broke as I'm trying to figure out like if I'm gonna be able to score another payment on a deal, or am I gonna have to go pull another draw from a HELOC that's about to run out? What I mean?
But you were handed a bad deal, Chris. I mean,
Yeah.
we have been handed a bad deal. And the fact that you're just figuring it out along the way is doing great, right? Like,
Well,
I hear you. I feel the same way.
yeah. I mean,
God, how am I ever going to get a job in my career again after this? I'm 53 years old. If I do survive, I'm going to be like dealing with ageism and all of that and why weren't you working for this portion of what a pain. And I but we are survivors because we were handed this ridiculous situation.
yeah.
So that's how I see
I
it,
mean,
you know?
it's definitely there's no doubt about that. I mean, that is across the board, and I openly admit I struggle all the time with quote trying to figure it out. I mean, I stopped
Yep.
asking for advice from because I eventually started realizing the people that I was asking for advice, they didn't have it to begin with to give to me. So it's not their fault that they couldn't or can't tell me what to do or how to do it. And that's like the whole journey of life is, figuring it out. And I mean, shit, I've been saying this and I need to just do it, but we'll just get a t-shirt that you can print on like Shopify that says, "This is me figuring it out." With a
Yeah,
QR
exactly.
code.
Or I have mucosal melanoma and all I've got is this lousy T-shirt or
Yeah.
something like.
Well, it's crazy because within melanoma, 10% is the rare subtypes, and mucosal is about 1 to 2%. Then you have acral, and then you have uveal and ocular. You have litigious, you have pediatric. So there's this other small subgroup. But if you just got it at the end of the day, and I'm not trying to be negative, but it's like you just got this shitty, you just pulled the wrong card. It's not like you
That's
could have
right.
done anything about it. It's like, sorry, kid. I mean,
Yeah, and
like,
everybody wants to know, well, what causes it? And
no,
I'm
and
like,
that's the thing. It's
well,
just like what, like nothing you could have done to prevent it. You can't tell anybody on how to treat it, prevent it. Like there's no. I'm throwing just shit against the wall, hoping it sticks. And it's just like the best thing you can do is as soon as you notice that anything's wrong, go get it checked out. Two,
yep,
don't be complacent about anything. Ask as many opinions. Seek as much advice as you can. And three is try to approach it with any kind of positivity that you can find from it. I mean, if I didn't get diagnosed, end up moving in, throwing all my crap in storage and moving in with my parents, I would have never been able to save the money to buy a house. I mean, I was still
right.
working because I needed the insurance. And because of that, I was like,
Yep,
oh, this is the first time ever I've actually had money in savings. I'm paying off some debts. And I worked for a home builder at the time. I'm like, I've always wanted to own a house and get out of the rent game, and the timing could have never
yeah,
been more perfect. And so I look at it now like I can't. I don't have the crystal ball. I don't have the time machine. Like I try to promote the mental health aspect of it, of being able to connect with your community and talk about it. And conversations like this is exactly this is better. This is more therapeutic than paying the $200 an hour to educate some therapist or about some disease and some treatment they've never heard of, for them to just do this and nod their head. And then but the only thing they're worried about when I come in is, hey, so you're on for next week, right? Like what time? It's like,
yeah,
damn. And so it's frustrating. I'm saying it's,
yeah,
but I mean, that's the cards we're dealt,
yeah,
and it is what it is. But I'm very adamant about trying to tell people I had everything backwards when it came to clinical trials, I and or anything else in the medical world, because like if you don't have to deal with it or know about it, why would you? I'm saying it's,
yep,
and like there's a good portion of the population that grows up, they don't you don't buy cable, they're not watching TV. I'm saying they're stuck on their phone. I mean, so it's different age groups and different demographics. They're on certain platforms, and it's like if you can meet them where they're at, and there's a way to get across your message without it being so specific and streamlined. You can be comedical, you can be funny, you can appeal to people, but you got to be authentic and you got to be organic. You can't sound scripted. I'm the first
yep,
person to admit, like, I wrote out this thing yesterday and I was going to post it to this other platform about this other post I was doing. It was just kind of like, I am flawed, but that's also what brings me my value, is the fact that I'm not scripted. I am flawed, and
yeah,
that authenticity is, as a patient, is what I was always looking for. Was like I wanted to talk to and hear from somebody that literally experienced it, about what it was like, and how they navigated that. If you're hearing it from somebody that's didn't actually do it, like, how authentic is it? You know what I'm saying? So,
yeah. Now you're offering that to
I mean,
people, so
shit.
that's a gift, and that has a lot of value. And so I think you've figured that part out.
I just at the end of the day, it was just there. It's even though whatever situation I'm in, I know it's important, and it's helping people. And there's no official position or anything for that, but there is a need for it. And testimonial, like someone from yourself, who I mean, who's been through it. You know what I'm saying? I mean, I it's just like, man, I was crying on my way home from the dentist this morning thinking, like, so stoked to, I'm doing my next pod with Deanna this morning, like,
Yeah.
you never know
Yeah.
who's gonna hear this and what it's gonna mean to them.
Well, it's been a good conversation for me, so
I appreciate it, and, I mean, it means the world. Absolutely. So, couple quick follow-up questions before, we jump off.
yeah.
Future conversations, would there be anything you'd want to highlight that we didn't talk about or go over?
I mean, not that we didn't. I think my highlights are, the decision-making component. Figuring that out for this community, and we're doing it. We're helping each other make decisions on what to do next and getting other opinions, but, you know, I think looking at what we can really do to, like I said, oncologist community accountable to helping us make our decisions and really understand the why behind them. But that's the biggest thing for me. And then, I'm still in that mode of decision making and figuring out what's next. And, at the end of the day, it's us as patients. We're the only ones who can really decide. I think getting support in that is important. So, yeah, that's my main thing.
That's 100 right there. I think you hit the nail on the head with that. I mean,
Yeah.
like,
Yep. 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 But this is supportive, and I'm talking with some other folks, and I'll come around to it and I'll get the information I need, and I'll do the next right thing and go on from there.
absolutely. Well, once again, Deanna, I can't thank you enough for coming on today and sharing your story, sharing your experience, talking about TILs, TIL talks. And, I
Of course.
say this all the time, and it's, TIL not only means tumor infiltrating lymphocytes, but it also means today I learned. And so I very much hope that somebody out there that's listening to this learned something that they didn't already
Yep.
know. I mean, because, you know, that's the whole point. So
Thanks so much, Chris.
absolutely, to everybody out there, I'm sending love. Peace. All right, that concludes today's episode of Till Talks with Chris White as we talk TILs, tumor infiltrating lymphocytes, and all advanced cell and gene therapies. As a reminder, I am not a medical professional or medical expert. I am only a professional and expert on my story and my experience. If you are needing or seeking medical advice or assistance, please reach out to your care team. I'd like to thank my guest today for joining me on Till Talks. To our listeners who have not yet done so already, please follow, comment, subscribe, share, and smash that like button. For more information about Till Talks and related resources, please visit www.tilltalks.com. I'm Chris White. As always, sending love to everybody. Peace.